clean tech company, but when I read about it, I was very enthused. I'm of the generation that played contact sports, played a lot of hockey, baseball, soccer, football. I even had concussions when I played football. When I read about the technology of Neuroptek, it was very intriguing. One of the things that intrigued me the most was, as a coach for 13 years for kids in minor hockey, I'm an economist and I'm a volunteer coach on the bench. I'm being asked to diagnose concussions on the fly. It's not fair to me as a coach, it's not fair to the kids, it's not fair to the parents. So, without getting into the technology and without further delay, a big round of applause for the founder of Neuroptek, a neuro-ophthalmologist and a neuroscientist with over 60 publications in scientific and medical journals. All that to say, he's very smart, a lot smarter than me. I've had too many concussions. So, without further delay, Dr. Behzad Mansouri.
Thank you all. I'm Behzad. This is Neda. She's my wife. She's the love of my life, and she's my boss. She's our CEO. So, with that said, we are so humbled that you selected us to come to the 5 finalists, and good luck to everybody. I am excited to talk about EyeMirage again, which is powered by AI, is a device, and we believe that is the future of eye and brain care. So as you can see, this is EyeMirage, and I will talk about it. Where our journey started. In 2019, we both were professors at U of M, and we decided to take a year off. She did her subspecialty in concussion at U of T, and I did a year of sabbatical to do more research and do volunteer work. During this volunteer work, we went to suburban areas, the schools, and we volunteered to do eye examination and neurological examination for kids who otherwise did not have this opportunity to get their eyes tested. And you can't believe our experience. We saw so many kids that were suffering from eye diseases and concussion and so forth, but they never got help. In fact, the research confirms my opinion, and it shows that 25% of the kids in the schools, primary schools in Canada, they need immediate attention for their eye and so forth. And only 30 to 50% of them, we have ability to give them services. With proper eye care and concussion care, these kids will have better reading, academic performance, and better opportunity jobs in future. This is not a hidden problem. 3 to 5% of people are suffering from lazy eye, and even these famous people that you can see here, I'm sure you all can recognize who they are suffering from visual impairment because when they were kids, there were no eye examination for them. So this condition is not only limited to kids. Adults have this problem. As mentioned here, they get concussion and the coach doesn't know how to examine them and diagnose them with concussion. In fact, there are 3 million emergency visits in North America for concussion. There are over 127 million visits that we need to provide to our population. We hardly can provide that. That makes our healthcare costly, unavailable to many people, and with long waiting time in emergency rooms and in office doctors. Telemedicine definitely is going to be part of the solution in future with a market of $500 billion a year. EyeMirage, we believe, is part of this telemedicine and is portable, is AI-powered, is simple to use, is affordable, it relies on a smartphone platform, and is AI and cloud cloud-based. It can do many tests. As I said here, just jargons, forget about the jargons, but these are the tests that when you go to your optometrist, to your eye doctor, they do this test. You have to wait for sometimes hours to get this test done, but you can simply do these tests with like activating your app and putting that in the device. There you go. You have your device at home. $500,000 device that we use in our clinics, you can have it at home. So we have multiple business revenue models. We sell device, we rent the device, we have a SaaS model with the app that we have. The total market for concussion and eye disease is over $200 billion a year. So we are hoping to take a part of this market. Our track is reasonable and acceptable. We have 15 patent documents and 2 patents that are already issued in the United States. We have spent over $1.5 million on this project so far. Half of that came from the founders, from our family. And go-to-market is that at the beginning, we want to target the healthcare professionals who know how to use the test, how to interpret the test, and so forth. But then eventually we're gonna go into all the Shoppers Drug Marts, Walmarts, everywhere that you sit and you want to have a quick eye examination. And then after that, we're gonna reach out to coaches, to schools, to teams, and hopefully they can help, and even eventually to every single home. So our team is wonderful people, exceptional people. Dr. Ansari, she is one of a few concussion subspecialists in Canada. I am doing neuro-ophthalmology. Bram is wonderful. He's so good at regulation that he is advisor to FDA. Henry has 25 years experience in marketing, and we have wonderful team. We are raising $1 million at this round. $750,000 of that is non-dilutive, and we have already have a commitment and granted 2/3 of that. We are raising $250,000 dilutive, and that's for a 5% share stake in the company. And we are going to use that for expanding our marketing and getting the regulation and clinical trial done. So it's wonderful to make money. All of us want to make money, but come and help us to help some kids with their vision and neurological problems in the meantime that we are making money. Thank you so much.
Thank you very much for that presentation. Next, I'd like to introduce for Q&A, Trudy Martins.
Thank you very much for the presentation. It's been great getting to know you over the last couple of weeks. My question for you is: it's hard to start a company. It's hard to grow a company, and there's lots of challenges along the ways. What would you say is the main hurdle that you've been able to overcome as you've been growing your company? So what would you see as sort of your main accomplishment in the last couple of years?
I think one of the main things that we are very proud of is our team. We have put together really exceptional people in the area that they are doing their activities. In terms of the science and medicine, we taking care of the eye part and concussion part, and as you saw, we have a wonderful team.
Yeah, I think putting all these devices that doing eye care. If you ever seen an optometrist, you definitely have seen all these devices. They're huge devices, and we were able to put everything in this little device and an app. So I think that is one of the greatest achievements that we had with our wonderful team.
Certainly an accomplishment. Congratulations, and I look forward to the future.